It's what do you take from here and use every day at home.
Right.
If you had a diabetic child, you would learn to handle the diet every day.
Yeah.
You would learn to handle the insulin every day.
What about this concept of stressors in one's life? I mean, pain is clearly chronic, ongoing pain is a stressor.
Yes.
How's that connected to how you feel, and especially with chronic pain?
What we know is stressors. Stressors can make you feel lousy. Stressors affect every part of your life. The difficulty is we're not really taught how to deal with stressors or recognize stressors. My approach is I look at where the stressors are manifesting. There's five parts of us as humans: emotions, behaviors, thoughts, relationships, spirituality, and I look at all of those, and I focus my treatment based on where their stressors are the most. Mm-hmm. It's so important to know, okay, what's stressing them. And you guys know this. You'll have somebody going along well on their pain management regimen. They come in crying. There was a death in the family. Nobody's addressed what the grief.
What has happened to the pain.
What has happened to the pain.
Yeah, well, the pain oftentimes flares up.
Oh, it definitely does. They're not sleeping. They're not eating. They're crying a lot. They're dehydrated from crying. Mm. And we got to look at that. And if you'll recall, they did a study. I think our occupational therapists and other psychologists did a study to see if we had a cookie cutter track of treatment. And what did we come up with? 64 different tracks. So
to treat pain within our practice, to treat different types of pain, or to address the individual's. Every individual comes in with different problems of what's causing them stress, and people are complex. So they've got different. They've got jobs. They've got different family considerations.
Right.
They've got a lot of variables in their life. And so it doesn't. When you're treating patients, there's no one particular way that we found that has worked. That says, hey, if you do this every single time, that you will have the best outcomes. When we have multiple different ways of treating patients, when you add up all the variables, including what is going on in the patient's life, it may add up to 64 different ways of treating a patient's pain. Right. And we say 64. It's not necessarily that we've got these 64 individual tracks.
You're a number 3.
Yeah. No. It's just that as we've looked at things, there's multiple different ways of treating patients, especially when you have a multidisciplinary approach.
And we've talked about this. If somebody's intelligence is less than average, you can't use cognitive behavioral therapy because they don't understand that cognitions are thinking and they have no ability to abstract.
To meta-think.
Yeah. Or if there are some folks who cannot achieve mindfulness. Mm-hmm. Because they can't abstract, or for whatever reason.
Or you might have a brain injury of some sort.
Precisely.
That makes some of the teachings or deliveries very
right. Maybe the accident that they had that caused the chronic pain also was a traumatic brain injury. So there's certain things you cannot use. Or an Alzheimer's patient. Yeah. Very, very concrete, one step, two step.
There's no one size fits all.
Exactly.
Especially when it comes to how dynamic life can be. And so. What is your overarching message that you can bring into a patient or someone that's coming over here for the first time there, and they say, why do I have to see a psychologist? What is the first thing that you would say to an individual that says, look, I just want to feel better. I don't need to talk to someone that looks into my private brain in life. Yeah. What would you say to them?
Look, you know this. We've talked about it. The first thing I tell them is they may never have to see me again. Mm-hmm. That this is part of the workup. If they go to a well-renowned pain clinic, I know Mayo does this, they're going to have a psychological assessment. I'm not there to dig into their past about abuse or trauma or do you love your mother. I very, very straightforwardly say this is to help the doctors provide you with a better level of care. That's predominantly what I say in the beginning. I also don't come out and say this, but I operate as a cheerleader, and I will say you've probably been told there's nothing more that you can do. You've probably been told you just have to learn to live with it. Our job is to teach you how. That's
live
what we're
with the
about.
pain.
How to live with the pain. I'm not going to promise you'll be pain-free.
Right.
I don't make promises I can't keep because that's lying.
Because I think we can simplify it in a lot of ways by saying, look, there's pain, and there's the suffering of pain. And so we could do the best that we can on the medical kind of side of the house, where we're doing procedures and medicines to help with the actual pain as it is manifested in the body itself. But the suffering issue as a result of it is that is oftentimes in how people perceive their pain. It's also so much of their psychological past.
Exactly.
And also that you don't necessarily have to suffer it as much. If we are able to handle some of these stressors that you might have been coming in with before you started with us, the new stressors that you may inevitably meet as you go down the road with your pain treatment. There's so much of that, how you are able to deal with those things that can increase your suffering.
Pacing, rest.
Right.
So much that you can do.
Or decrease your suffering, or not suffer as much with the pain, if you adopt some of these skills.
That's a great dichotomy, pain versus suffering. And yes, there's going to be pain. Even acute injuries have pain. But how much can we decrease your suffering?
And could you say that maybe is psychological resilience?
Exactly. And we've talked about this, a lot of research right now on resilience.
Yeah, and so that's what we're trying to kind of flip the whole paradigm on its head. I mean, this is not new in the world of pain, but
it's not new in the world of psychology either.
Right. But it might be new to patients. Saying, hey, I'm going to a doctor's office, and so I have these expectations that I need to get medicine, I need to get this, but what we're trying to say is it's so much more to it.
Exactly.
And that's what the psychologists help us figure out.
Exactly.
So we really appreciate everything that you do for all these years.
I love being here.
And so we want to thank you for all that you do, and hopefully clarifying this for all of our patients.
Thank you for having me today.
Yeah, you're welcome.